Currently, we have with us Dr. Purvi Parikh, who's joining us from her office in New York City via Skype. Here is hoping to getting even more information, latest updates and information. Let's welcome on the show Dr. Purvi Parikh. Thank you so much for joining us.
Thank you. Thanks for having me.
Of course, and I truly appreciate your time and your efforts. As a doctor, first I want to really showcase my gratitude and really thank all of the frontliners, just as yourself. Dr. Purvi Parikh, we're looking at today's Thursday, and a lot has happened this week in terms of research, in terms of finding out about cases, in terms of the panic and fear. Right now, the stats I have say over 215,000 cases in this country, over 5,000 deaths in the country so far. I know you have some current updates and latest information. Wanted to open up the interview to that.
Right. So, I mean, there's a few things. I know the numbers are very scary,
Yes.
and everyone should take it seriously because it is very contagious. Many people are being affected constantly. The good news is the majority of the cases are people that are in the process of recovering. And even though there's 5,000 deaths, there's close to 8,700 people that have fully recovered, which is nice. So that's some good news. The rest, though, there's almost 10,000 that are hospitalized and still recovering. Some new treatments that are on the horizon is for using patients' antibodies that have recovered and using them on sick patients. So basically using the blood and plasma of recovered patients and giving that immunity to very sick patients. So some hospitals in New York have started, as well as other sites around the country. And then finally, some surprising news that the medical community got is that we're seeing very young patients affected. The first baby, unfortunately, passed away last night, only 6 weeks old. And that's puzzling to all of us because until now, we thought, babies and children weren't as badly affected.
Correct. And do we know, Dr. Purvi Parikh, right now, what exactly caused it? Was it COVID itself fully?
Right, so that's a very good point. We don't know that it was COVID that caused the child to pass away or if it was just a coincidence, because we do know that many people are going to be testing positive for COVID, but they might not have any symptoms. And many people might have mild forms of disease. So they're investigating it further. It may have had nothing to do with it or something to do with it, but time will tell.
Right. Dr. Purvi Parikh, while I have you, I really want to discuss something that's very major in terms of coronavirus right now. What we're looking at, the peak that they keep on saying is going to happen in mid-April. We're looking at April 15th as the date. A lot of audience is asking this question about what do you predict will happen during this peak? And what does that mean when we're looking at in terms of sick patients, in terms we're looking at PPE, we're looking at hospitals and beds. Where do you see the hospital capacity or just the capacity to take care of patients during that time period? We're very close to it right now.
Right. No, it's worrisome because many of the hospitals in New York and New Jersey are full. Some in Bergen County are so full that they're having to turn patients away. They're diverting patients. So it is concerning because we're not at the peak yet and we're already full and running out of resources. So I think more drastic measures will need to be taken in the next few weeks. There's talk of completely stopping air travel, closing airports. It's terrible, but it might be a good move. We might have to get much stricter with the social distancing.
Right. So assume we hit April 15, Dr. Purvi Parikh. I want to know for our audience watching, what will happen during that time period? And, what happens in 2 weeks? What happens in 4 weeks? Where do you see, the concerned patients sort of, come into the spectrum? Who is really at risk in the next 2-3 weeks?
Right. So, the most at-risk people are elderly, those over age 60. Certain chronic conditions put you at higher risk, like diabetes, high blood pressure. If you have any lung conditions like asthma or COPD. And then also if your immune system is weakened, you're at higher risk if you have cancer or an immune deficiency. But the thing is, we're actually seeing a lot of healthy people hospitalized and sick too. So it's not just protecting others, you really need to protect yourself too, even if you have no medical problem.
Definitely. And in terms of discussing a little bit more about lungs, since you are an allergist and immunologist and your expertise is in infectious disease, Dr. Purvi Parikh, have you researched or found more details and more current updates as to what exactly is it doing to the lungs? I know a lot in the news is about it making these sacs in the lungs, causing pneumonia, but for our audience that is still trying to understand, there's so much uncertainty about what is exactly happening to the lungs and they're just collapsing. Could you reflect on that a little bit more for our audience?
Right. So because this is a brand new strain of the virus, there's a lot that even us doctors don't know about it and that we're trying to figure out. What we do know is that it causes a very severe pneumonia involving both lungs and all of the lung fields. And that severe pneumonia can lead to something called acute respiratory distress syndrome, which can be very dangerous, and people need to be in the ICU on breathing machines. But there's a lot that we know about this attacking the lungs and causing very low oxygen levels, which we don't understand exactly why. We also know it attacks the heart, it may attack the brain too. And we're learning about the virus as we're treating it. That's what's so challenging.
Right. And in terms of these vaccinations we keep on talking about, the drugs that are on trial, what do you predict as a time frame, Dr. Purvi Parikh, when we are looking at by the time we're actually finding out how we can make sure reoccurrence doesn't happen of this virus, what are we looking at right now in that time frame?
Right. So, the vaccine trials have already started, which is good news. We're hoping within a few months they'll be ready for widespread use. But, we always have to test things and make sure it's safe and effective. So that takes time, to see if it works, if the immunity is mounted. And then certain treatments we're already testing now in sick patients, such as, giving blood from recovered patients or certain antiviral medicines or antimalarial medicines. Hopefully those results will have even sooner, if not the vaccine.